Bismillah ar-Rahman ar-Rahim. I'll be discussing left main stem PCI evidence and practice. Now, left main stem disease is found to be in 3 to 5% of patients undergoing coronary angiography. And patients with LMS disease have a high morbidity and mortality because of the large myocardium at risk. Most of the patients of LMS disease are treated with cabbage. Syntax trial subgroup analysis showed the PCI is a viable option in left main stem disease patients. Now, this is the percentage distribution of involvement of different parts of the left main stem, and it is most common at the bifurcation, which is 66%. Now, bifurcation lesions are divided into true bifurcation and non-true bifurcation, depending upon whether the main proximal main and the side branch have more than 50% stenosis or not. These are various different classifications which you all know very well. And Medina classification is the most commonly used classification, and in Medina classification, as you know, a number is assigned to, number 0 or 1 is assigned to lesions. If it is more than 50%, it is 1. If it is less than 50%, that is 0. And broadly, there are two bifurcation strategies, as has already been discussed: provisional and two-strand strategy. And these are the various two-strand strategies which you are well aware of. According to the syntax trial, cabbage resulted in a fewer major CV events compared with PCI among patients with triple vessel coronary artery disease or left main stem disease. The syntax trial, the scoring has been divided into 3 groups, which is low syntax, intermediate, and high syntax score. And the cutoff is 22, 23 to 32, and more than 33. This was a trial, recombat trial, which showed that at 10 years, there was no significant difference in MACE between 2 groups, which was cabbage versus left main stem PCI, although the risk of repeat procedures was more in case of PCI group. The Excel trial, which is a landmark trial, it showed that the left main coronary artery disease patients with low or intermediate syntax, they are good for PCI. And again, there was more incidence of revascularization in the PCI group. And this is, again, the outcome of the Excel. Similarly, Noble trial, another landmark trial, in which there was a composite of all-cause mortality in repeat coronary revascularization with stroke, and occurred in 29% patients treated with PCI and 19% patients treated with cabbage. These are the different meta-analyses which had been done from 2009 to 2021, and various different trials have been done in patients with high-risk anatomy with LMS disease and multivessel disease. Cabbage is, of course, has the clear advantage. The patients with low or intermediate syntax score, they can be taken for PCI. This is the definition of complex bifurcation criteria. There are major and minor criteria, and there are 2 major. If the lesion is more than 10 millimeter and the stenosis is more than 70% in case of left main stem, and more than 90% in case of non-left main stem disease. A complex bifurcation is defined as either 2 major or 1 major and 2 minor criteria. These are the various trials which have compared the provisional versus two-strand strategy, excluding the last one, which is Nordic 2. And in almost all these trials, the provisional strategy showed better outcome. These are few more trials comparing provisional versus two-strand strategy, and they have been done till 2021. Now, there are certain features which favor provisional strategy, which are, for example, small-sized circumflex, insignificant disease at the ostium of the circumflex, small length of the lesion of the circumflex at the ostium, right dominant system, and a wide angle between LAD and the circumflex. Now I'll present a case, a 76 years old gentleman, Canadian fidelity class 5, hypertensive, smoker, labs unremarkable, presented with non-ST elevation MI. And this was his angiogram. This shows disease at the distal end of the left main, including the osteoproximal LAD as well as circumflex. And you can see the various views. The right coronary artery is essentially normal. There is no critical disease. His syntax score was 26. And as far as syntax 2 is concerned, there was a PCI, 4-year mortality for PCI was 14%, and 4-year mortality for cabbage was 20%. And his Euroscore was 10.19%. And here's the indication for the use of intravascular imaging, which is IVUS. It is class 2A indication. Now, IVUS helps us in making the decision about the luminal size, the plaque distribution, plaque characterization, stent sizing, and the length of the disease. So it is a very helpful modality, and I think everybody believes that it should be used in all left main stem PCI. Heart team meeting was done. Actually, patient was advised cabbage, but the patient family were counseled thoroughly for that the cabbage is a superior option. However, they declined cabbage and they opted for a PCI. And a 7 French sheathless guide catheter was taken, and both LAD and circumflex were wired. LAD was pre-dilated with 315 balloon, and circumflex with 2.75 NC balloon, and left main stem with 3.5 12 NC. IVUS was done in both LAD as well as circumflex, and these are the runs of IVUS. So you can see a lot of atheroma, critical disease, and some calcium. So we proceeded with the procedure, and we stented, we parked a balloon in the LAD and placed the stent in left main to circumflex, deployed that, and crushed with that 3.5 12 NC balloon. And then step crush was done with 4.58. I will go through quickly as the bell has rung. And dot was done. We did, this was basically DK crush technique, and we did all the steps. And I'll be quickly going through these steps. So this was the stenting of the LAD. This was pot done with 508 NC balloon, recrossing and opening the studs. And this was the final result. IVUS run was done, and final port again was done with 508 balloon. And that was the final result. Recovery was uneventful, patient stayed well, there was no complication, and he was discharged next day. This is the data of FIC. In 2023, we did 123 cases of left main stem PCI, and 93 cases were done with provisional strategy, whereas 27 cases were done with DK crush technique, and 3 cases were done with other techniques. And on the right side is total number 42, and then DK crush 28, and other techniques 13, and that is the data of this year till June. Thank you very much.